Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Guess what? I'm in studio. It's Memorial Day, and it's a gorgeous day outside. You need to go out and enjoy it and walk and talk, but make sure you keep the radio on so you can listen to me for the next hour. And make sure as you go the highways and the byways and the restaurants and on the parks and so forth, if you know somebody or if you see them in uniform, thank them for their service, because that's what today's all about. It's observing the dedication, the things that have been done for your freedoms, and you need to extend at least a thank you. And if you see somebody in uniform, pick up their tab and just say, listen, this one's on me. I appreciate who you are. 888-630-9625. That's 888-630-9625. That's how you talk to me today on the program, and how you talk to me off the air whenever you have the opportunity and you'd like to get a message to me. It's real simple. All you need to do is go to drtomroselle.com. That's drtomroselle.com, and we'll get back to you. And if you'd like somebody to contact you with a very specific question, go there too and send us a note and say, hey, listen, and don't forget to make sure you leave your phone number and how we can get a hold of you. Appreciate your interest in Dr. Tom Roselle. It is expanding dramatically. We're linked in a couple stations, and you can always listen to us no matter where you are. You can go into the computer and check us out that way. Go to drtomroselle.com, and you can hook up with us there and listen to us, be you in Texas or Canada or overseas. And we understand that we're being listened to on Armed Forces Radio. I appreciate that. Thank you all. 888-630-9625. Lots of things to talk to you about today, things that are exciting, things that are saying, oh, my God, I didn't know that. As the program goes on, we're going to talk about the little tart cherry and what that has to do with inflammatory reactions in your body, and something that I lovingly like to call frankenfoods, and what Monsanto has cooked up for you, and the state of your health, or the devastation that it's going to take as time goes on. It's already causing a lot of problems that it's being covered up. It's been swept under the rug. So if you have any influence at all, politically, publicly, if you want to stick your nose on the chopping block, with mine, by the way, then you have to do something about this, because your lives, your health, your children's, our grandchildren's, all of us are in jeopardy at this moment in time. So we have to take action. And we're going to take action today because we're going to tell you about all kinds of things. In the news, nutritional news, there's lots of things out there. I want you to know about that. And you need to really pay attention to some of these things that are coming down the pike, because if you don't, you do it at your own risk. I've been preaching to you for years now that vitamin D is critical, and that most people up in this end of the world have little or no vitamin D status. What do I mean by that? Well, if you look at the laboratory ranges, they range from 30 to up, in some labs 32, but up to 100. That's the range to say if you're in that range, you're normal. Well, normal is not normal. Remember, we keep moving the parameters out. Let me tell you what normal really is. If you're not above 50, 50 or less is considered insufficient. 32 or less is extremely deficient, and we see all kinds of things that show up because of that. Forget about just bone loss. We're talking about immune system function here. And what we see is that there are increased risks for people that don't have high enough levels of vitamin D. What kind of risk? Cancer. What other risks? Well, how about neurological demyelinating diseases? A study just came out on vitamin D and Parkinson's disease. And the recent trials were published in the American Journal of Clinical Nutrition, and what they said is that vitamin D supplementation in men and women decreased the progression of Parkinson's. Now, 114 Parkinson's disease patients were randomized to receive this study and to be involved in it. And all they gave them was 1,200 units, was way below the thresholds that we give people. And they also, some of them were given a placebo, so it was, one of these double-blind situations. And it was involved with Parkinson's Foundation, and they used traditional scales of breakdown that also has been done by two guys called Hone and Yar, and Unified Parkinson's Disease Rating Scale. And what they showed was really very simple, straight up, that the people who took vitamin D as a result of the study showed a slowing of the progression, and that's only at 1,200. We know anecdotally and clinically that when you give high enough levels of vitamin D, that you can begin to see massive changes in neurological degenerative conditions. I mean, this is unbelievable stuff. Go to the American Journal of Clinical Nutrition, 2013, March the 13th issue. I think you're going to be impressed. It's interesting. Got a couple other things that are out there that you need to know about, and it's called that whole thing about coffee again, and we talked about the good news and the bad news. Well, another article just came out, and when you look behind the scenes, you got to ask the question: who published it? What do they know about it really? Or are they trying to kind of put their own thing out there? Well, an article published in the Journal of Stroke reveals there's a protective effect for green tea and coffee against stroke in middle-aged men and women. Interesting. Remember, it was green tea first. And green tea, by the way, much more impactful, much more significant than coffee. However, what's the problem with coffee? And I bring this up because everybody asks me the question, if I had 10 cents for every time I was asked that question, I'd buy myself a very nice automobile right now. But here's the deal. Coffee's got some problems. The caffeine in coffee goes to the same receptor sites in the brain that cocaine and heroin and so forth, and so it's an extremely addictive process. That's number one. Number two, it's acidic. Unless you go out and get something like 100% organic Kona coffee, then it's almost neutral, but it's still about 6.9. Then you got to look at the oils and the tannic acids and so forth, which compete with the body for the absorption of iron within different cells and so forth. Not a good thing, in my opinion. Some people can't handle it because of the high levels of irritation with coffee. Now, you say, well, I'll just drink what? Decaffeinated. Well, the problem is, unless you're getting a water-filtered, organic, decaffeinated process, then you risk irritating the proximal head of the pancreas and increase your risk of some forms of pancreatic cancer. So you have to make a decision. Is that something that you want to risk, or is it something that you want to, decrease your risk? A guy by the name of Yoshiro Kokubo, MD, PhD, he was the guy that did this recent study and was out of Japan, and Japan Public Health Center-based study, and they released it this last year. Matter of fact, about 2 months ago. Again, if you go to magazine Stroke 2013, March the 14th, you'll see that study, and you can decide for yourself. 888-630-9625. That's 888-630-9625. Love to answer your questions. Marion from Maryland, how can I help you?
Yes, there seems to be a great big push in the senior communities now, and in order to avoid knee surgery, to get these injections, SUPARTZ.
Yes.
And I was wondering if it also helped your hip.
Well, here's the deal. First, let's talk about why suddenly you're getting this big push, okay?
Right.
And the reason is that once you get into the senior levels, you're under Medicare.
Right.
And you're going to be controlled by the government.
Right.
And as time goes on, you're not going to be able to get knee replacements, and you're not going to be able to get anything but drugs and walkers and canes and so forth. That's just the way it's written. Because, see, we're into that situation. So let's hope that things change. But having said that, the drug that you're talking about is basically something called sodium hychloronate, and it supposedly acts to buffer and increase the knee. Now, there are many different ways, in my opinion. Okay, I'm not a big proponent of using anything like this that has side effects, and whether you can use it or not. They tell you that you have to use it for any kind of knee degeneration. Well, why is it just the knee? And you only use it when you don't have you're not getting results from anything else and so forth. And they want you to use things like ibuprofen and acetaminophen and naproxen and so forth, which by the way are NSAIDs, and they cause further degenerative changes. Now, they're using it in studies where they're trying to decrease the inflammatory levels of the degeneration. Now, the problem is that that's not the only thing. But if you have allergies to any common things, and you've watched the commercials, said, in case of yada, 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 and this situation goes on in eggs and chickens and poultry and so forth, and, it's mind-boggling. So anybody takes this stuff, and I can go on and talk to you about, the degenerative diseases that go along with this, the infections, the skin infections that they warn you about, and, the other types of reactions, the autoimmune system. So it's not a great drug. So what can you do? You have arthritis. Are you stuck with it? My comment is always going to be no. There's a whole lot of things that you can do to make a difference. So what you do, and I'm not going to point the finger at you, okay? I'm just going to give you kind of checklists and things to think about. When your doctor tells you you have arthritis and that's the problem, well, first of all, there are many patients in my practice over the 37 years that have arthritic changes, but that's not the reason for the pain. That's not the reason for the immobility. You get to a point in life, you get above 35, 40 years old, and you're going to have some joint space breakdown. It's inevitable because we're active people and we screw up our diets. We eat too much of sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives. My mantra, if you've heard me, before. And our lifestyles are inactive. We don't do what we should do. And then when we get small injuries, we ignore them. We don't step up to the plate and try to remedy them in the early stages. So you have arthritis. You have to look at the structural, chemical, emotional pieces. Structurally, we know that every joint has a muscle that usually crosses over it. So let's take the knee, for example. The knee has many muscles. You have a big muscle called your thigh muscle. That's 4 muscles. It's called the quadriceps. And then you have muscles to the side, in the one's called the iliotibial band. And you have one to the inside. It's called the gracilis. And I can give you a full anatomy lesson, but there's a bunch. And remember that these muscles are controlled by nerves from the spine. And they also, we've talked about in our model of applied kinesiology, that these muscles also have related organ systems. So the organ system and the muscle is controlled by the nerves, by blood supply, by acupuncture systems, and so forth. So now the problem gets a little bit more expansive. So let's say that the thigh muscle is weak comparatively one side to the other. So now we have to find out, why is it weak? Not why the swelling in the knee, why the degeneration in the knee, but why the instability that's causing that joint space not to work properly. So we know that the quadricep muscle, the thigh muscle, relates to intestinal tract. Well, guess what? If you're putting junk in, the muscle's not going to work the way it's supposed to. So, all the garbage foods that we eat, the gluten foods that we eat, the GMO foods that we're eating, the fried foods, the sugars, the additives, the preservatives, and it goes on and on and on, is going to cause a reflex phenomena that will cause that muscle to be unstable, subsequently the joint not to work the way it's supposed to, and then when the joint gets injured because of all those things, then the inflammatory levels get much higher. What happens? We go to our doc. He says, well, you have swelling of the joint. What's caused it? I don't know, but you have an inflammatory reaction. Take this medication. Take the Suparts, and let's see what happens. Take the Celebrex, and let's see what happens. It's all the same garbage. So you want to turn things around, you have to turn it around from fixing the underlying process. If you know your diet isn't as good as it should be, then use, just as a rule of thumb, 80% alkaline type of diet, 20% acidic. Stay away from fried foods. Stay away from saturated and trans fats. Stay away from the sugars, except for things like in berries and fruits and a little bit of honey and so forth. Don't use any of these artificial sugars. And you'll begin to see your inflammatory levels, just with doing that, go down. Begin to do gentle type of exercises in the beginning stages. You can get somebody to work with you on that. Acupuncture, chiropractic care, nutritional guidance, those things work dramatically to turn that around as long as they're put into proper sequence. Now, I know I'm confusing you.
No, you're not. This is fabulous.
Okay, good. So what's the point of it is Marion, is that you have options other than drugs. And drugs make life worse for you. Anyway, we've got to take a break. I'm sorry I've been going on. We'll be right back. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. We are in studio. It's Memorial Day. Go out and say thank you to our armed forces and the people who have helped us stay free. We're here at 888-630-9625. That's 888-630-9625. October 19th. What's that? That's Ageless Health 2013. The 3 keys to keeping your health optimal. It's a day that you don't want to miss. Put that date aside, and this week, I promised you that towards this week, once we get back in the office, everything will be posted. You'll be able to register. Do it quickly, simply because those of you who've attended in the past know that we sell out, and I don't want to leave you alone. Marion, I want to apologize. We came up to a hard break, and I had to drop you. I'm very sorry. However, are you still there?
Yes, I am.
Okay, good. So I'm going to wrap it up very quickly, but the point of it is that if you change dietary patterns first, those are the things that you really have control over. If you begin to get a good examination, not from a traditional physician unless they really understand functional medicine protocols, and you see somebody who can combine acupuncture and manipulative therapies, you can get a whole lot better without drugs and guidance. Now remember, Rome wasn't created in a day, and it takes a little time step by step, but your body is extremely forgiving, and it will change.
Thank you for being there for us.
You're welcome. Thank you for calling. Appreciate your phone call. 888-630-9625. Love to talk to you on any subject that you have in mind. We're talking about other things today that you need to know about, because if you don't, your health is at risk. And so what are we talking about? Well, we're talking about things that will affect your heart. Interesting information that we've known about for years is something to do with magnesium. And magnesium is this controversial thing that, people think that if you got 50 milligrams a day, it's enough. But the problem is this. Low levels of magnesium are related to increased risk of ischemic heart disease and muscle spasm and things of that nature. So, see, you need a lot of magnesium. It's burned up in a lot of areas. Under stress, it's burned up with neurological transmission. It's burned up in the cells of different body tissues, muscles particularly. Calcium, unopposed, meaning calcium without magnesium, is a problem. Why? Because calcium causes muscles to tighten. Magnesium relaxes them. So you have to have a ratio. Ladies, once you're in menopause or above, you need to have 1 milligram of magnesium and 1 milligram of calcium. Sometimes more magnesium than calcium, because otherwise you're not going to get absorption, but also you're going to get tetany, you're going to get cramps. It's one of the first indicators of cramping all over the bottle or muscle spasm all over the bottom. But what we're talking about here with the heart is that it causes the heart to go into spasm, stopping the flow of blood to the heart. And then subsequently, guess what happens? Your heart stops. Not a good thing, right? Really not a good thing. George from McLean, Virginia. How can I help you, sir? Thank you for calling.
Hey, good talking to you again, Dr. Roselle. Like what you say about all the natural stuff. I'm really into that. I've spoken with you before online. I have a question for you. I'm a large guy. Large meaning not out of shape, very in shape.
Okay.
6'5", about 260.
Okay, I remember you. Okay.
I have a problem with arthritis in that I've broken all the joints in my hand several times, whatever. My one finger is the joint's bigger. I'm sure it's arthritis. I've been told that it's arthritis. I've also had a problem with gout in the past. I've taken all the medication for gout, although I'm not on the permanent medication. I take Celebrex when it gets real bad, and some of the other things.
Which unfortunately increases your arthritic degeneration.
Well, that's my question. The gout I can control with diet. I mean, if I fall off a diet, I know the triggers to the gout. I know what not to eat. My thing is with the arthritis, and I understand the Celebrex. I got to tell you, anything above 50, the arthritis. You take Celebrex, it's like, man, this stuff is the best. I'm going to marry it.
Yeah, well, the exception that'll give you a heart attack and drop you dead on the spot.
Well, hopefully that's not going to happen. All the time I spend in the gym and I eat right. My question is, the last time that I had a gout attack, the typical gout medication really wasn't working. The Celebrex, I heard is bad for the heart, so I try not to take it.
Okay, so let me. We're coming up to a break, and I want to really answer your question. So
okay.
let me jump into it a little bit here and talk to you a little bit about the need to take any medication. Tells you that you've got a systemic problem that's not being resolved. That's number one.
Right.
Okay, gout is a result of a failure of something called purine metabolism. That's an end product of liver function. So subsequently what happens, uric acid levels go up. Very quickly, when I get in the second half of the program, I'm going to talk about cherries, and that's one of the things that is used, but it's the components in cherries that work. But the problem that you're getting is you're getting a buildup of the wrong types of components, chemistries within your system, allergy reactions, I can almost guarantee, because I've seen way too much of this stuff over the years. But I'll give you two things that work to control gout. One is black cherry juice, black ox heart cherry juice. That's number one. Number two, there's a homeopathic called Ledum Polester, and that works very well with acute flare-ups. But I'm going to get into it. I'm going to talk a little bit more about that, because you can have a gouty arthritis type of thing. But I'm telling you, my friend, the fact that you're having to go this route tells me that your body biochemically is not working the way it's supposed to, and it really needs to be looked at and directed. You're doing some great things, but not quite enough. We're coming up for a break. We got to listen to the news and some people who support Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. I'm in studio, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject. I've got a few. We've been playing with a little bit of arthritis, a little vitamin D, things of that nature, but I do it for you. See, the reason that we do this program, and we do it every Sunday, and I make sure that I get my butt here so I can do it live for you. Very rarely will I insult you with a recorded program. I do it because I want to give you the most cutting-edge information. And as I always say, don't believe me or anybody else. What I do and what my job is to provoke you to make sure that you do your homework, to get out there, see if I'm right, see if what I'm telling you is the truth. It is, but nevertheless, check me out, see if it's really that way. Go to our website, drtomroselle.com, drtomroselle.com, and don't forget, this week, we will have registration open and ready for Ageless Health 2013. I expect to see you there. Beth from Springfield, thank you. How can I help you?
Oh, thank you, Dr. Tom Roselle, for these wonderful topics and for coming in live over this major weekend. I was just wondering if you could answer two quick questions. What is the safe level of D3 per day for a person without tests? First, is it 2,000 about the safest level without tests?
Listen, in my opinion, you can take probably everybody in this area could take about 4,000 units. Very few of you couldn't, but 2,000 to 4,000.
2,000 to 4,000.
2,000 to 4,000 without any trouble whatsoever.
Fantastic.
Now
I have a second question. I developed for some strange reason, I can't explain why, a toe fungus on both of my toes. It deformed the toenail, but no other, it had no other effect. It's still there to this day without any other symptom, and none of the other toes were affected. Is there any food or vitamin you can recommend?
It depends where it's coming from, because toe fungus is rarely, unless you've stepped into a fungus patch someplace.
It might have come from an old pair of shoes, perhaps, that I threw away.
It's possible, but your immune system still has to be susceptible. The real contact stuff came back from the guys in Vietnam that were with the jungles forever.
I think the toenail's trying to heal on each foot, and other toes affected. So is there anything?
So give it. I'm going to give you a couple things to do. Now, just checklist, okay? First of all, when you're treating any fungal condition, you want to eliminate anything that's going to grow fungus. What's that? Any kind of dairy, any kind of sugar, any kind of alcohol, peanuts, peanut butter, peanut oil, mushrooms of any sort, and anything that is fermented. Now, directly on the toe, get yourself a bucket of water that you can put your foot in. And, you want to put maybe about, 2 quarts of water in it, and it should be tepid, just slightly warm. And you're going to put 2 tablespoons of Clorox bleach, not chlorine bleach, but Clorox specifically,
that you put on your clothes?
Yep. Now, listen up, okay? Clorox only, not a chlorine bleach or a chlorine substitute, but the original Clorox formula, 2 tablespoons for every cup of water. So if you got a quart of water, you're going to have 8 tablespoons of Clorox. And you're going to put your foot in, you're going to soak it for 30 minutes every night for about a month. Within that period of time, you should get a good control. If you do the dietary patterns and you do that, that should help. The other things, there are very specific nutrient bases. I'd have to know way much more about you to be able to tell you what to do.
Where would I get this Clorox? You said it was original Clorox?
Yeah, just go to the store. Go to the grocery store.
I mean, it's not the kind you use on your clothes.
Absolutely it is.
It is.
It is.
The Clorox bleach you get in the white bottle for your clothes.
Yes, the active ingredient is chlorite.
And so you take 2 tablespoons of that and put it in 2 quarts of water.
No. Listen, 2 tablespoons per cup of water.
Oh, per cup.
Per cup of water. And so use that, but don't use any other bleach substitute. It has to be Clorox. Okay?
Okay.
Beth, thank you. I appreciate your call. Dolores, how can I help you? Thank you for calling.
Thank you. I was watching TV. I have colitis, which I think is the same as Crohn's. I really don't know. But they were advertising a medication spelled Humira.
Humira, yeah.
Do you know anything about that?
Oh, I know lots about that. Not something that you want to put in your body. But, by the way, it's not the same. You can have an irritable bowel problem. You can have Crohn's. You can have colitis. You can have a lot of things that make your gut go bad, but there's a very definitive diagnostic situation. Humira is mostly used for rheumatoid patients and very degenerative conditions like it does use for Crohn's, but it's not one of the primary things. It's used for ankylosing spondylitis, psoriatic arthritis, degenerative disease. But the problem is that the side effects are huge. I mean, it dramatically suppresses immune function. And, if it'll increase any risk that you have of cancer, it'll increase your body's ability to heal anything. It'll increase your ability to potentiate to diabetes. If you're, kind of on the borderline, it can kick you over the edge and take you the rest of the way. Not a great drug. It's and by the way, and for our last listener to springboard off that, it dramatically increases your risk of getting any kinds of fungal infections, particularly in the lungs, things that are called histoplasmosis and coccidioidomycosis and so forth.
That shouldn't even be on the TV.
None of that stuff should be on the TV.
Because they were definitely pinpointing Crohn's disease.
Yeah, they're going to try to sell it for anything that they can. It's there's other serious side effects of the thing, including TB, tuberculosis, also hepatitis B. It's all there. I mean, you want to make yourself crazy. Go in and type in the web, say Humira, look at the side effects, and if you take this drug, you got to be out of your mind.
I'm not.
I'm not telling you. I'm saying just generally anybody.
No, I saw it last night, and it was a rather large ad.
Yeah, it's craziness. I mean, the drugs, generally the drugs that are out there. And by the way, if there's a druggist out there, or if there's a drug rep or a medical guy who doesn't agree with me that these things have the side effects and the damage, call me. I'll dedicate the rest of the program to you. We'll go back and forth and we'll talk about this stuff. But the problem is this stuff is devastating. In my opinion, you reverse reverse the immune function within the body. You increase the function of the adrenal system. You detoxify the body. You repair the intestinal tract.
Wow.
And life gets a whole lot better. And there's so many different ways of doing things. Dolores, thank you. I appreciate your call. 888-630-9625. You know, I do get crazy with this stuff because I'm here to protect you. I'm here to let you know that you have options, that there are other ways of getting things done. And unfortunately, we're being blindsided. We're being duped. You know, I was going to talk about cherries, and I'm going to just touch upon that a little bit. But, you know, cherries have a lot of really great things in there. They can protect you against degenerative diseases. They decrease inflammatory reactions within the body. They're really, really excellent stuff. When you have, you know, a problem where, you know, providing everything else is going well, you have an inflammatory reaction because you worked out too hard, so your muscles are inflamed, go drink some cherry juice. You don't have to drink a whole glass of it. You can drink like 3-4 ounces of it, mix it up with half and half with water. If you have gout, you know, black oxheart cherries are great. Tremendous anti-cancer mechanism with cherries. Tremendous. There's something called anthocyanins that are found in cherries that work extremely well to protect your genes, and they block the different pathways that cancer begins to go crazy with, and the adenomas that we end up with. Great product. Just, you know, it's amazing that, you know, but by the way, it's got to be non-GMO. It's got to be organic. It's got to be clean stuff. Just don't go buy, you know, cherry juice that's had all kinds of stuff added to it, particularly sugars. I wanted to get in something with all of you today because things you need to know about. I'm reading a book right now called Seeds of Deception. And if you really want to lose your mind and go kill Monsanto, read this book. I mean, really go read it. Seeds of Deception. Frankenfood, or genetically modified food, it's everywhere. And you're seeing it in restaurants and supermarkets. And see, the problem is it's not labeled, and it's going to kill us all. You know, most of us have no idea how much of it we're getting, where we're getting it from, unless you do your own research. And you have to be very careful. So you have to err to what? Organic foods, period. You know, more than 54% of American crops contain GMO. 54%. And roughly 70% of processed foods have at least one genetically modified ingredient in it. Now, why is that such a bad thing? Well, let me give you an example. They are growing different seeds now, or making different seeds, plants, that are designed that when they get to a certain stage, they produce their own anti-weed stuff, like Roundup. And you're getting that in your body because it doesn't go away. It still modifies the genetic makeup of the plant. You're getting it. Yeah, I'm telling you the truth. Not surprisingly, there's a huge amount of money that's at stake at this thing. I mean, Monsanto, you know, in their team, they're the biggest guys in the marketplace, although there's many others. They're reporting up to $13.5 billion in sales just last year. And that's up. That's up 14 to 15% from the year before, and it's going to get worse. It's going to continue processing. And as I told you about a week or two ago, there was a bill that was snuck in and piggybacked in Congress that Monsanto can't get sued for this crap. You can't go after them. So guess what? Everything from cotton to soybeans to canola to corn, you know, over 50% of all of your papaya that comes out of California is genetically modified. It's really concerning. And let me tell you some of the things that are the most concerning to me and should be to you as a consumer is that, you know, critics, you know, keep banging it, but we're being put down a lot. But let's go back. Let's roll the clock back. 1992, the FDA, Food and Drug Administration, regulated the responsibility of GMO food safety to industry, right? They regulated the safety to the wolf. They regulated, you know, the fox in the hen house. I mean, give me a break. These companies themselves not only decide whether or not to consult with the federal agencies, but also what scientific data that they're actually going to submit for review and evaluation. Happens to be the truth. I mean, if this doesn't irritate you, nothing will. If this doesn't irritate you, you don't care one little iota about your health or your family's health. So here's the deal. You got GMO making the stuff, and they're deciding whether it's safe or not. So you got advances, that are coming down the pike and say, oh, this GMO stuff, we don't have to use pesticides anymore. We don't, it grows bigger stuff, and guys will tell you that all the stuff is the same. Poppycock. The acceleration in loose regulations are causing your health to be at risk. The first genetically modified food hit the market probably 2 decades ago, about 1994. And it was in the form of tomatoes. Since then, we're talking about sugar beets and potatoes and corn, squash, rice, soybean, vegetable oils, and animals that are being fed all this stuff. They get it, and guess what? Their genetic structure gets modified. It gets popped into your body as well. Interesting, huh? Well, 2011, American farmers planted more than 170 million acres of GMO crops. When is this stuff going to stop? It increases your risk of all kinds of disease processes. It increases your intolerance to things. It causes breakdown in tissue. It causes your organ systems to be more susceptible to tumor formation. There are bugs that these toxins no longer can stand in fight, because they're building things that are supposed to kill them directly. But the problem is that, like anything else, the bugs become super bugs, and guess where the effect actually is? In your stomach, in your intestinal system. Not a good thing. You have got to take a stand. That's if you really want to protect yourself and your family. It even goes beyond that, and we could talk about this all day long. But I'm going to tell you, go pick up Seeds of Deception, read the book, do the research. Don't listen to the talking heads on television, because they're going to lie to you, as they always do. And that's why I'm here. That's why we have this program. That's why Dr. Tom Roselle is on the air every Sunday giving you this data. You've got to pay attention, and for God's sakes, go out and do your homework. Otherwise, life as you know it is not going to be a pleasant experience 5 years, 10 years, 15 years from now for any of us. Not a good thing. Coming up to a break, we have to listen to some very important information, and those of you who want to bring Dr. Tom Roselle to you, we'll be right back.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle Web Store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle Web Store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle live, 888-630-9625. That's how you find me every Sunday, right here on the dial that you're listening to. And don't forget, if you'd like to reach us after the show, off the air, very simple. Go to drtomroselle.com, drtomroselle.com, and we'll get back to you. I like to answer as many of your emails as I can personally. So make sure that when you write me, you are very specific. I can't diagnose your condition specifically, but I can give you guidelines and where to contact and who to go to and so forth. And if you're outside the area, if you're like California and you're listening to us, or you're in Canada, I will always do my best to get you somebody that I would trust my own family with. So make sure that you ask if you're outside. Let me know where you're calling from, where you're writing from, and we always do our best to make a difference. Your life is, and your health is, a do-it-yourself program. It's critical. It's important that you take control, that you realize that you are not somebody's whipping post. If you choose not to do anything, then unfortunately, subsequently, you become the effect of everything else around you. But stand up and take a position. It's not a great thing for you just to sit there and do nothing. Don't forget, October the 19th. I expect all of you there because this is a day that is going to be over the top. Ann Abernathy, 5-time Olympian, Grandma Luge, is going to be there. You know what's so special about Grandma Luge this time? Well, Ann, who is in her late 50s, now is competing in archery for this next Olympia. Amazing, huh? And by the way, she's world ranked already. I mean, this woman blows my mind. You can have the opportunity to listen to her. We have another call. I want to take it very quickly, and then we will tell you what you need to do to protect yourself today. Linda, thank you for calling. Got to make it real quick, my friend.
Yeah, it's a real simple question. I hear a lot about pros and cons about soy. What is it about soy? Is it good for you, or is it bad for you, or what?
Yes. Okay, so if you're getting organic soy that is non-GMO, you can have it, and you just have to be very careful of the processing. That's the whole problem with soy. I don't agree with all the pundits out there that say that soy is something that you should never have. Sue will always, we'll do soy occasionally in our house, and she gets tofu and she marinates it all day long, and then she boils it at nighttime, and we put that on top of first a bed of we do some brown rice, some hard cut small grain brown rice, and then we put stir fried vegetables on top of that, like a spinach or a kale, whatever that we saute in olive oil and garlic, lots of garlic, because that's who I am. And then we put the tofu that's been marinated and broiled on top of that, and we call that dinner.
That sounds great.
It is great. So the truth of it is that, yes, it depends on where you get it, what it is, and the processing. So just be very careful. Organic only, and do it occasionally, and you're not going to get in trouble. Yeah, if you want to come and eat at my house, no, never mind. Sue will kill me if I put that out as an invitation. But she'll teach you how to do it. All you got to do is call the office and make an appointment, and she'll teach you how to put these things together. I keep trying to get her to put a cookbook together. Maybe we'll, we email her and tell her, listen, we want the cookbook. Maybe she'll do it. I don't know. We'll be here next Sunday, 12 o'clock. Tell your friends about Dr. Tom Roselle Live. Have a great day today. Don't forget to salute our armed forces. See you later. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.